those who don't know me, my name's Gillian. I'm Town Centre Manager over here in Northern Ireland. And a bit like yourselves, as the title of this conversation is, the second wave and a winter of discontent. It's starting a lot sooner than we thought it was going to be. And I just think maybe this is maybe a rationale to, well, what they've been saying on the street here is, if we can do this now, can we save Christmas? And it sort of follows on from the previous conversation that we've had. But I think here in Northern Ireland, we're having the same difficulties in terms of borders and the different restrictions right across all our different jurisdictions. Ours will come into effect from tomorrow in terms of the additional lockdowns. And there are some ambiguities, especially around the hospitality sector. Basically, everything shuts tomorrow at 6 p.m, apart from takeaways, which can go on to 11 o'clock. All health and beauty, close contact, all finishes at 6 o'clock as well. And as those are the majority of our town centres here in most of our rural towns, it is going to have a massive effect. But I think people are resigned to the fact that this has to happen in terms of a circuit breaker. The problem we have within our border counties here as well is that the Southern Ireland have just brought in their new restrictions, and they take place from tonight at 10 o'clock. They are shutting retail. We are not shutting retail. They are shutting all hospitality, including hotels, B&Bs. We still are not sure about that. They are not shutting the schools. We are shutting the schools for 2 weeks. So there's ambiguity on both sides, and I think we're finding that across all the jurisdictions, just the comments coming out from Wales, Scotland and England, and even within England itself. So I think we're all in the same boat. A lot of confusion and a lot of maybe resigning the fact that, yes, this maybe has to happen, but the big concern is what will be the support going forward, because the guidance still hasn't been confirmed. The support still has not been confirmed as well. Plus, we're going through the transition phase in terms of all the different furlough schemes and the different grant schemes. So it is a very turbulent time. And I'm going to hand over to OJ to give an update on the whys and the problems and the restrictions and all those sorts of things. And then we'll hopefully have a good roundtable discussion at the end. So I'll hand over to OJ now.
Thanks, Gillian. Yeah, the whys, the wheres, the whats. There's so many questions, so many issues. Now, usually for these network meetings, I do a quick 5-minute introduction of the topic. This is going to be quite a bit longer just because of the amount of things that have changed over the past few. I mean, literally hours. Even today, we had our all-party parliamentary group for town centres, which was disrupted because a whole load of MPs have had to disappear to discuss the restrictions coming into place or changing in their particular area. So it's been a challenge just getting all the information together, just so everybody can have the heads up on what's happening across the UK and Ireland. So I'm going to give this my best shot, but I'll be honest, literally since this presentation was finished about half an hour ago, things may have changed. That's how difficult it is. So can everybody see my screen? Fab. So we have the winter surge, which has started. Now, the experts have been saying that COVID-19 would return during the winter months, but I think we've just all been taken aback by how quickly that surge has happened, how quickly that second wave has come in place. Now, I was on a Zoom meeting a few weeks ago with a number of council officers, bids, and one public health official as well. And a public health official based down south said, and this was a few weeks ago, said that looking at the numbers, they already thought the second wave was official. It just wasn't being talked about publicly. Well, now it's fairly public and it's fairly obvious. And the challenges are right across Europe. So in terms of the UK, the figures are all fairly clear. Oh, sorry. The figures are all fairly clear. In terms of infections, we are at a place where we're seeing record numbers of infections day on day exponential growth throughout September. Now, we do have to bear in mind that testing capacity now is a lot higher than it was in the spring. So it's genuinely difficult to tell how much worse off we are now than we were in the spring, but it's not good. As of yesterday, across the UK, nearly 20,000 people tested positive for COVID-19. Now, the warning signs have been there for a while, so a lot of you will already know that it's been discussed by Sage. There was a Sage paper that came out on the same day in which Boris Johnson announced the new three-tier system for England, and this Sage paper sort of came out quietly, and I actually got it in my inbox, and I've gone through it, and there's some really interesting stuff in there, and actually read between the lines. There's a lot of criticism maybe of what the government has done in recent months, what the UK government has done in recent months. So the paper identifies that there's been an increase in incidence of COVID-19 in all age groups. One of the myths we're going to need to get past, which there will be more information on as we go, more evidence on as we go. This isn't actually about schools or universities. The second wave had started before schools and universities had gone back. That's concerning. That's really concerning, because it means that the impact of school and universities in some of these stats are still yet to come. Doubling time is as little as 7 days nationally. The full impact the full impact of schools and universities is yet to be seen. Sage is looking for non-pharmaceutical interventions to get us back to a place where the R number is below 1. So for those people that don't know what the R number is the reproductive rate. So if one person infects one other person, then the virus doesn't grow, but it doesn't shrink either. The R number, as I understand it, is somewhere between 1.3 and 1.7, so it is growing. And the Sage group wants to see if they can get that R number below 1 as quickly as possible. They don't divide into specific area, and they want rapid and stringent measures as fast as possible. And the package of measures, and I think this is an important line, because I read this as a criticism of schemes like Eat Out to Help Out. The package of measures needs to be consistent and not contradictory. So they're looking at something which people can understand as being consistent across the board, not stay in, but go out and eat. And I think that's something Sage has been challenged.
Nonsense.
They recommended a circuit breaker, a short lockdown.
Not reflecting the seriousness.
I'm just hearing some feedback coming through. Everybody just make sure they're on mute.
Not saying there won't be a second wave. And what's happened?
I think it's Elizabeth.
Oh, Liz, can you just put yourself on mute? Oh, fab, that sounds better. So Sage recommends a circuit breaker, which is a short lockdown. They're saying everybody has to work from home. They said a ban on households mixing apart from support bubbles. They recommended a closure of all bars, restaurants, cafes, indoor gyms, personal services, hairdressers, and that all university and college teaching should move online. So they were the recommendations of Sage. And one of the things we also have to take into impact as well is there's always a time lag in terms of infection happening. You get symptoms about 5 days later. Hospital admissions don't often happen till between 2 or 5 days after that. So literally from infection, it's probably around 10 days until there's a hospital admission. And then another 9 to 19 days after that, you're either looking at either a discharge or death, which is pretty grim. But from start to end, it could be as long as a month for there to be a conclusion in infection. So let's break it down by regions. So for England, the graph is as shown. So we're seeing a big peak in England for October. In terms of some of the stats, this is why everybody's talking about the north of England as being fairly challenging. So in terms of weekly case rates, the areas which are the most challenging in terms of case rates are those which are darkest on this particular map. And you can see here, it's the northwest, it is a Liverpool City region, and it spans just a little bit across the Pennines and certainly parts of the northeast as well, which are places where there is the highest amount of infections. However, it's the next graph which is probably just as concerning when it comes to understanding where we will find out what happens next. So this graph shows the rate change. It's how quickly infections are going up. So yes, again, the northwest is an issue, but then look at just how much of the northeast is a challenge, and then right down the spine of the country, the Midlands and parts of London as well. The infection is growing quickly right across the spine of the country. So there's a lot of challenges there for a lot of places. So what the Liverpool City region is seeing now, I think parts of the rest of north of England will see soon. And then in time, the Midlands and likely London as well will all have exactly the same challenges unless there's a halt to the spread. And you can see here, I think this is the graph which has various people that additional measures were needed in Liverpool, and that is the amount of hospital admissions seen in Liverpool in terms of the north of England. So there's a spike in many places, but the exponential growth in Liverpool, I think, is being seen as really challenging, and it puts a lot of pressure on the NHS. So in England, what we've seen is the introduction of a tiered system, and what the Prime Minister is trying to do with this tiered system is balance health and economy and take a regional approach rather than a blanket lockdown. So the tiered system, I think hopefully most people will know now, tier 1 is medium risk, tier 2 is high risk, and if you're in a tier 3 area, that means you're in an area of very high risk. There is no low tier. That just does not exist. So this is not a traffic light system, because a traffic light system would include a green. We don't have a green in this system. So tier 1 medium risk, that's the rule of 6. Businesses and venues can operate in a COVID secure manner. Certain businesses, so this is hospitality, food and drink can only be consumed while seated. And these areas, this is the curfew, which a lot of people are not happy about. These businesses must close between 10 p.m. and 5 a.m. Businesses and venues selling food off-site can continue to do so after 10 o'clock, so long as this is through a delivery service, click and collect, or drive through. Schools and universities can remain open. High risk, tier 2 areas, it's ever so slightly different. So it's not the normal rule of 6. For indoor settings, you cannot socialize with anybody from outside your own household or outside your own support bubble. You have to stick to your own household or support bubble. The rule of 6 still applies outdoors. Travel should be kept to a minimum. You can still travel for things like work and education, but travel must be kept to a minimum. And then for tier 3, the very high risk areas, this is slightly different, because rather than a blanket approach to tier 3, there is a baseline. And this baseline is that the rule of 6 does still apply outdoors, but again, you cannot mix with anybody outside of your household, outside of your own support bubble. There is a stricter approach taken to those hospitality venues. If you operate as a restaurant, you can continue to remain open so long as you're serving substantive meals. All other hospitality venues must close. Pubs and bars must close. No wet sales. And that is the baseline. So what will happen is, in addition to the baseline, central government will consult with local authorities to see what other restrictions should be in place in terms of the selling of alcohol, in terms of the operation of hospitality, in terms of indoor and outdoor entertainment venues and tourist attractions, and the closing of leisure centres and gyms. So it will depend on the nature of infections in a particular area. There will also be other things like libraries, like personal care businesses and close contact businesses, and performing arts venues. All of those will be down to consultation and will depend on the specifics of the area if it's a very high risk. So for England, there's a number of places that have just moved up into tier 2, and they include London, Essex, York, Chesterfield, Chester, Greater Manchester, Derbyshire, Lancashire already in there, West Yorkshire already in there from the beginning of the day, South Yorkshire, Durham, a number of areas, West Midlands, Leicestershire, Nottinghamshire, all tier 2 areas. Tier 3, as we know, is mainly the Liverpool City region. All of the regions in England at the moment are tier 1, but this is changing on a daily, if not hourly basis. Just recently, what the UK government has brought in for England is a £30 million fund allocated to all district and unitary authorities, including Metropolitan Borough and London Borough Councils in England, to spend on compliance and enforcement activities for COVID-19. The government is encouraging areas to spend this on marshals. So these are the COVID secure marshals. And if you want to call them warden, stewards, or ambassadors, then that is fine. But they are going to be there to support compliance in terms of social distancing. So the role the government wants the COVID marshals to take on is to promote social distancing and encourage public compliance with COVID-19 public health measures, to educate and explain COVID-19 secure guidelines in the public realm, and for business premises, and to identify and support businesses and premises who may not be following the guidelines, and to escalate that where appropriate. That funding is going to be available, I think, over the next 4 months, so for most of winter. So that funding is being made available based on a COVID needs formula for each local authority, and I think we've put the funding allocations on Basecamp, so those will be available for you. Moving on to Northern Ireland. Now, one of the things which is different for Northern Ireland in terms of this graph in comparison to England and the rest of the UK is that the peak Northern Ireland is suffering now is disproportionate to the challenges Northern Ireland had during the spring. So during April and May, the number of people who tested positive, in terms of this graph, it's at a much flatter level than other areas across the UK. So actually, in terms of Northern Ireland, so many of their infections have actually only just happened in the past few weeks. That's why the Northern Ireland Executive has taken a pretty hard approach and has looked at the circuit breaker. As of yesterday, Northern Ireland had reported a total of 21,898 cases altogether, but more than a quarter of these cases have only happened in the past 7 days. That's how disproportionate it is in terms of the Northern Ireland situation. So the circuit breaker is coming into effect on the 16th of October and will be in place for a period of 4 weeks. And this means the closure of the hospitality sector, apart from deliveries and takeaway food, which will have to stick to the existing closing time of 11 p.m. Other takeaway premises as well, in line with this, will be closing at 11 p.m. Bubbling to be support bubbles will be limited to a maximum of 10 people from 2 households, and there will be no overnight stays in private homes unless it's part of a bubble. Off licenses and supermarkets cannot sell alcohol after 8 o'clock, and there should be no mass events involving more than 15 people. Gyms may remain open, but only for individual training and only with local enforcement in place. And again, the order is, if you can, work from home. Universities and further education should use distance learning if they can. No unnecessary travel. What they're going to be doing is they're going to be extending the half-term break so schools can stay home. So that half-term break is now going to run from the 19th of October to the 30th of October. The retail sector for now can remain open, although there will be further discussions on what else the retail sector needs to do to help suppress the virus. The executive is currently looking at what support is needed for those businesses that will be affected as a matter of priority. Going north of the border to Scotland, this graph looks at the change in the R rate for Scotland over the past few months from May up to the end of September. And this is where you start to get the idea that actually the R rate has been growing, not necessarily because of schools and universities, because if you look at this graph through August, the R rate grew significantly before schools and universities were open, and that trajectory has carried on since then. So that means a real challenge. This is down to the reopening of the economy, so that means some real challenges in terms of getting this back under control when we want to keep schools and universities open, because they all have an accumulative effect. I think in terms of the look of Scotland's infections, it's fairly similar to England and Wales, but a bit different from Northern Ireland. After recording more than 1,000 new positive test results in a single day earlier in October, the Scottish Government has already introduced new temporary measures to slow the transmissions. So restrictions on licensed premises came into force at 6 o'clock on the 9th of October, with all other restrictions coming in at midnight on the 10th of October. And they will remain in place until the 26th of October, where they will be reviewed. So these restrictions, which I'm going to go through, they are restrictions which are nationwide, with the exception of the central belt in Scotland. So that is for hospitality, so food and drink, all premises may remain open indoors between 6 a.m. and 6 p.m. with no sales of alcohol. Premises may be open outdoors until 10 p.m. with the sale of alcohol where licensed. Takeaways, including pubs and restaurants, can continue. And the rule of 6 will continue to apply. Now, there's been some real challenges across the central belt where transmission is higher. So for the health board areas of Ayrshire, Arran, Forth Valley, Greater Glasgow, Clyde, Lanarkshire and Lothian, all licensed premises will be required to close, full stop. That's with the exception of takeaway services. Cafes, which do not have an alcohol license, will be able to open between 6 a.m. and 6 p.m. Takeaways can continue. Evening meals may be served in accommodation for residents. So I think that's looking at things like hotels and student accommodation, but no alcohol can be served. There are no group exercise classes for things like indoor gyms, no outdoor live events. A lot of entertainment and leisure venues need to close, like snooker, pool halls, indoor bowling, casinos, bingo halls. Public transport, the use of public transport needs to be minimised. And again, the rule of 6 continues to be in place in the central belt with a maximum of 2 households. The Scottish Government has brought in some support. So there is now a COVID-19 restrictions fund, which will provide one-off grants up to £3,000, depending on the rateable value to bars, restaurants and other businesses required to close, and a hardship fund with grants of up to £1,500 to support businesses that remain open but have been impacted by the restrictions, such as businesses in supply chains. There is a £9 million fund for the refurloughing of staff, so I'm not sure if that's now the new job support scheme from the UK government, and also a discretionary fund of up to 11 million to help businesses that need support but don't necessarily fall into the categories of sectors which are really challenged at the moment, such as hospitality. And there's also support for those people who are asked to self-isolate under the test and protect system if they are low-income earners. What Scotland is doing is it will look to align with England's three-tier system. So that's something the Scottish government is looking into the feasibility of. Whether this happens or not, I don't know. It might be that they decide the three-tier system is more trouble than it actually solves. But that's something they're looking at, and that goes back to what Gillian said at the outset of the meeting, of just making sure there is some level of alignment across borders. On to Wales, again, very similar looking graph. Wales has already adopted a localised approach in terms of new restrictions, and these restrictions include reduced household mixing, especially indoors, hospitality curfew again, ban of alcohol use elsewhere when that hospitality curfew kicks in. So basically when pubs are asked to shut, supermarkets and off licenses can no longer sell alcohol as well. And also the Welsh government is asking people to keep travel to an absolute minimum in or out of high infection areas. Now the places facing local restrictions in Wales are growing. And when you look at the list, you can see it's quite significant. So places like Bangor and Bridgend and Caerphilly, Cardiff, Denbighshire, Collenny, Merthyr Tydfil, Neath, Port Talbot, Newport, Swansea, it continues. And I think with that growing list, and again, that is changing quickly, the Welsh government is now considering a second lockdown as well. And it's also preparing urgent action to prevent people coming across the border from high infection areas from across the UK. So that's something the Welsh government is looking at as we speak. And then just finally, in terms of the Republic of Ireland, so south of the border where Gillian is, the Republic of Ireland is also seeing an increase in infection rates. It's not at or surpassed the level they saw in the spring, which is good, and it's not been mirrored yet in terms of deaths in the winter. However, there is enough concern that some towns, that the Republic of Ireland has 5 levels, with 5 being the highest in terms of restrictions, and most areas have been at level 3 for a really long time now. However, the news has just come out that at midnight tonight, as Gillian was saying, some of those border towns, Cavan, Donegal, I think there's a few others actually, which aren't on this list, all move into level 4 from midnight tonight. Now the priority is still to keep schools and childcare services open. Businesses and other services which are essential will be kept open. However, those not deemed essential will be asked to close from midnight tonight. So that confirms what Gillian was saying earlier. So that's pretty much it in terms of just some of that information which is coming forward, which is changing on a regular basis. So Gillian, I'll hand over back to you just to open up a conversation about just about everything to do with the challenges people are facing and what ATCM needs to be doing to supporting you in terms of policy asks.
Yeah, I'm going to throw it open. At the start of this, I sort of did an overview of what we're feeling here. We feel that it is a necessity maybe to go through this process for a few weeks. I think the fear is, how long does this last? And also what is the support going to be? Because there has to come a point where the support, we just can't afford to keep supporting, and therefore what drops off. And I think we've been talking about this for a number of weeks, months now, in terms of what will we be coming back to at the end of this. People are getting a bit fed up as well. So in terms of bringing in marshals and COVID marshals, I don't envy their task, to be honest. And we have talked over here, it was on the news at lunchtime, is should we be using our local council enforcement officers, traffic wardens, people like that to do the enforcement, because they're used to it, they're trained in it. And and use that as a support mechanism to the police. But I see Richard Gates has come in. He says he would like to talk on the COVID marshal. So maybe if we kick off with that to see how that's actually working. And then if you want to raise your hand or anything, I'll bring you in. And I'm sure Kenny has something to say in terms of Liverpool as well. So if we start off with Richard there, if you want.
Hi everyone, hopefully you can hear me all right. Yeah, so I just thought it'd be useful. Like I said, we started this last week, although fortunately our number of cases in Cornwall is obviously sort of very different to many other places in the UK. However, because we've got two universities right on our doorstep in Falmouth, we've got Falmouth University and the University of Exeter, the Cornwall campus. And because this basically came about in September, when of course we've heard all the stuff on the press when people are moving to different parts and different, with not just the students, but that was a focus from the mayor's point of view. We had a lot of breaks of rule of 6, everything in terms of in September. So it's linked from there. We've used a local security company who actually we've employed through the town council, and then it's recharged to the universities. But I have to say, since launching it, it is only early days, but feedback, a press rent went out from the universities, but the feedback has been really, really positive, taking your point, Julian, and we're concerned about how it would come across. Ours are focusing on the kind of 4 p.m. to 4 a.m., which I know sounds a bit extreme, but that was where we were having the challenges late at night. They are also looking at that late night noise in like parties as well as those sorts of things. And of course, their powers are relatively limited, but we've also bought a couple of body worn cameras, and the university, particularly from, I don't want to alienate just the students, but they will find the students if it needs it. But I have to say, the majority of people have been very, very good. It's just topping that up and gives some reassurance. And it's been picked up on the press on all radio stations in Cornwall, loads of like written media everywhere. And on the whole, I can't say everyone, but on the whole, majority of people have been really positive about it so far. It's almost a kind of a first strike, and then after that, you know, sanctions would be further increased. But it's really about gathering the evidence and that reassurance to the community and linking in with the businesses in a positive way, rather than it feeling like it's, you know, hitting with a stick. Because I have to say the majority of the businesses, certainly in the Falmouth area, have been very, very good with COVID compliance. And that's their frustration, that they've done all this effort. I'm sure many other places across the UK, they've made all this effort, and then hammering out, we've got these other restrictions coming in that's going to impact on them when they think, well, hang on a minute, we've done everything correctly. We're trying to be as safe and as sensible. But that was really what it was. I just wanted to say is that it has been well received. We've only got, you know, we're a small town, we're not a big city, but it's a couple of guys. It's for 4 weeks that the universities are paying for, and then we'll review it whether it needs quite as long as that, whether it needs some more daytime activities. But they are out with our road closures in our town centre during the daytime anyway, from the same company. So we've got links there to review as much as possible. And I said early days, but it is working well.
Okay, thanks for that, Richard. I'm going to bring Kenny in now, because they are at the highest level in terms of tier 3 over in your jurisdiction. And I just wanted, again, coming back to OJ's point, if you can talk about what's happening there, but also how we as ATCM, what should we be telling government? Because I think OJ's keen to get that message back to them where possible. Thanks, Kenny.
Okay, yeah, I mean, I have to say, it didn't really come as a surprise over the last couple of weeks that we probably end up in the top tier. And having spoken with our Director of Public Health as well, and just to add on really what OJ said before, as well as hospital admissions, what we found in Liverpool, unlike other places like Greater Manchester, is that the number of cases isn't really just related to one particular age group. So we're not looking at the student population here in Liverpool, we're actually looking at figures right across the piece of all ages. So couple that with the hospital admissions, that's why we've ended up in tier 3. It still comes as a shock, obviously, to a lot of our businesses here with closing down. But even some of the restaurants that are allowed to stay open now have already shut because the support and footfall is not there. So if you've got no pubs and bars, people aren't going out. Do you know what I mean? So they're not going for a meal. So a lot of them have now taken the decision, a sad decision really, to close during this next few weeks. It really is sad. I'm not sure if anybody's seen the piece I put up on LinkedIn a couple of days ago from one of our sort of local venue, young entrepreneur. And I've watched this particular business grow and expand over the last 5 to 6 years. it's absolutely heartbreaking to see the interview that she made on Channel 4 News, you know, and she's not thinking about herself and her own business. She's thinking about the people she employs and the supply chain and the people they employ as well. You know, Liverpool, we've been blessed that, you know, we've got lots and lots of independents. Our independents far outweigh the number of nationals that we've got in operation at Liverpool City Centre. So it really has a big impact. But coming on to what ATCM could possibly do for Liverpool as well, obviously the city feels that government has been too slow once again, especially with financial support. So much so that the Metro Mayor and the City Mayor with the City Region have come up with their own fund, which launches tomorrow. So we've actually put in a £40 million grant scheme, which gets launched tomorrow morning with the first £10 million to be got there. So I think one thing ATCM could do is put pressure on government that people need the money now. You know, people need the money now. Bills are still coming in. You know, 67% for wages for staff sounds great. Not as good as the 80% that we had earlier in the year, but a lot of these people that are employed in this sector are on the minimum wage. They're on very, very low wage anyway. So getting 67% of a low wage, it doesn't help anyone. When rent doesn't get reduced to 67%, utility doesn't get reduced to 67%, and daily living doesn't get reduced to 67%. So it's just I suppose it's seen as a token gesture, really. But just to finish on that, I mean, everyone's probably saw the footage that was over the media when we went into lockdown on Tuesday night, and it was scenes in Concert Square, which is one of our busiest areas. But that footage showed that a lot of the people, and I'm not demonising students here, there were a lot of young people who had probably just arrived in the city as well, and basically a last hurrah. But also what we found through looking through our CCTV in the run-up to all that, part of the issue the other night was the mass exodus of people at 10 o'clock as well. Concert Square, for those that know it, know the geography, there's a lot of very, very popular nighttime economy businesses there, some of which can hold up to 3,500 people. So we're not just talking, you know, a few small pubs, we're talking venues that can accommodate, not in the current circumstance, but several thousand people who are still busy on Tuesday night. That was one of the issues as well. You know, I really do think that the 10 o'clock curfews needs revisiting. It really does need, because those scenes that we had the other night are going to be repeated in other areas of the country, similar to Tier 3.
Okay, thanks, Kenny. And I think I would echo that. And I see Nicol has echoed what you said as well in terms of the speed of response and the speed of information, I think has been quite slow. Even here in Northern Ireland, we got the message yesterday. Yes, we've had 2 days, but that's been 2 days to say, yes, we're closing at 6, but there's been no indication as yet in terms of what support is there.
Yeah.
So the financials are extremely important.
Yeah, I think the other thing that needs clarifying as well is that, you know, Boris Johnson, when he addressed the nation the other night, was more or less intimating that this was all done with agreement with the Metro Mayor and others, and it wasn't. It was imposed. You know, the Metro Mayor's come out and say it wasn't up for negotiation. The only thing that they were trying to do there was to get more funding to help business.
So more communication. I see Michael has his hand up. You want to unmute yourself?
Hi, can everybody hear me? Hi there. Right, I'm Mike Bushell, Sutton Coldfield Town Centre bid. I'm from Birmingham. So we're in Tier 2. I'd really like to echo what Kenny was saying about this 10 o'clock curfew, first of all, that doing that kind of thing is leading to people drinking earlier, having shots, and then let's all go back to my place. A lot of these regulations are actually driving drinking and socializing underground, because by taking out the opportunity to do it in a safer, controlled environment, we're just making the problem worse. And you start looking at the history of things like prohibition, and it's really the same kind of thing. Prohibition was to stop people taking alcohol. What happened? Complete and utter failure, and it is the same thing. So I just like sort of ATCM to point out that, you know, it's the unintended consequences that you're going to get out of this. But I suspect I'm not the first person to say that, having watched our Metropolitan Mayor actually tear into his own party, which was quite a sight, because we've got Andy Street in Birmingham. And just the other thing that ATCM could do, particularly for the bids here, well, it's for the local authorities as well. Bids are facing major problems from a cash flow point of view. We aren't getting the money in from levy collection. So we may not be able to do things that you would want us to do. It's really serious. The government missed its opportunity to actually help us out when they said that retailers didn't have to pay business rates. They forgot to do bid levy. So we don't actually have the money to do a lot of the things that we would like to do. And we're sitting on a time bomb that is just about to start going off in places. You're going to lose bids over the next 12 months. So my colleagues in the local authority may be facing to doing a lot of this on their own. Bids will not get through renewal because of the situation that we actually find ourselves in. Business, particularly major multiple systems, just cost, and no matter what it is we do, we are facing a major call on bids. So sorry to be negative, but you may not have us, particularly if this thing goes on as long as a lot of people think it will, like pretty well all through next year. So sorry to give a negative thing, but from an ATCM perspective, I think we need to remind people, we need to remind government that we're there, but we're hanging by a thread.
Okay.
Yeah.
Thanks for that, Michael. I'm just wondering, does anybody else want to come in with a comment?
Can I just come back on a few of those points, and then we can bring us in, Gillian? So,
Sally. And then Sally after that, okay?
Yeah, fab. Just firstly, in terms of the Liverpool situation and the North of England situation, I think that there's been lots of speculation as to why the North is struggling much more than the South of England at the moment. And from what I can tell from the evidence, the issue has been that during the spring, COVID-19 peaked at different times in different areas. So it actually peaked in the south of England first, especially through the initial epicenter, which was London. And then as lockdown was introduced, it started to even off in London, but then it started to peak in other places after that. Now, what's happened is when we've reopened across the north of England, the rates didn't fall to as low as they were in the south of England. So when we've reopened, the north is already at a higher infection level than the south. And so what you've seen is that it's taken less time to the north to get up to a situation where it's critical. So I think that needs to be understood. That's important. And I think in a way, I think there's plenty of things to criticize the government on in terms of its action throughout this. But in fairness, one of the challenges it's trying to deal with in terms of the tiered system is to have a localized approach, because sometimes that national approach, it is much easier with the cons, but occasionally you can make things much worse by taking a national approach on certain things, which might not be appropriate for certain areas. So that's important. On the 10 p.m. curfew, I absolutely agree. I think I used the word prohibition earlier on. While I won't necessarily attack the 10 p.m. curfew specifically, because I just don't have the evidence either way to say whether it's good or bad, what we will say to government is that we need to have an evidence base and we need to understand behaviour, because I'm not convinced that the 10 p.m. curfew is necessarily a good thing. So I think at the very least, ATCM should be asking for a strong evidence base on such issues. And then just on the COVID marshals and also bids funding as well, maybe there's an opportunity there for local authorities to actually be spending that money through bids, through their ambassadors, because those ambassadors will be much more business friendly than your normal enforcers. And it also helps money to keep going through bids as well. So maybe there's a role there for local authorities to use that money on bids to make sure they've got business friendly ambassadors doing that work, and it's not necessarily a sort of strong arm enforcement approach. So that's just an idea. So that's it for me.
Thanks, OJ. If I want to, Sally, you had your hand up, Sally Henley. If you want to unmute yourself, thanks.
Hi. Yeah, thanks for that. Yeah, I agree with everything everyone said. And there were just a few things that I would really appreciate ATCM's help with. And OJ, you were just saying about the evidence base. And one thing I would like the ATCM to put across really strongly is it's now a month that we've been asking for this evidence base. It's not kind of a new question. Everyone has been asking it repeatedly for the last month, and there has been no reply. It's just unacceptable that the government continues with this approach of just not answering the question. So I know our MP, Anne-Marie Morris, has been really onto that. I'm not sure that there's anyone particularly outwitted the government who understands the reasoning behind that. So I just wanted to, if you can sort of raise that point that it's now been 4 weeks since we've been asking the same question. The other question I would like to ask is this whole thing about this, the phrase circuit breaker. I think it's a bit like lockdown. It's become sort of it's now become a sort of almost a scientific term when it's in fact just a term that someone used. No one has actually said what is going to happen after that circuit breaker. So we had a circuit breaker for 3 months and it came back again. So, for the economy to be struck in the way that it is, and it will be, if Keir Starmer has his way, if Boris sort of goes down that route, we won't have an economy and we'll open up again and the same thing will happen. So no one in government is saying what is going to happen at the end of that 2 weeks, and the virus won't have gone away. So what is the point? And that's a question I would like to ask. What is the point? It may give them time. Is that what they're saying? Time to think of another catchphrase. But the cure is so much worse than the disease at the moment. We're never going to come out of this if we're locked down. There are going to be no jobs. So I just want to know sort of the reason for this circuit breaker. Do they think that the disease in that 2 weeks is going to go away? And what are they hoping will happen after that 2 weeks? So if you can ask that more succinctly than me, I'd be most grateful. Thank you.
Yeah, I'm going to try my best. So absolutely agree with you. Again, on the curfew, we need that evidence base. I think the rationale of the circuit breaker, as I understand it, and I'm not necessarily saying these things are right or wrong, but the one thing the government cannot allow to happen is for the NHS to be swamped. And I think that is the critical red line they don't want to pass. And going back to the slide I had right at the beginning, where you have the time lag from infection to hospitalization, the challenge is that any stats or figures we look at doesn't necessarily reflect the reality of what is going to happen 2 or 3 weeks when these things come to fruition. So the government has to be able to allow normal life to continue as much as it possibly can without getting to the point where the NHS is swamped. And I think given the speed of the increase of cases in certain parts of the country, I think there's a real concern that I don't know whether for some areas it may already be too late or we are on the brink and it just needs to be tugged back a little bit. In terms of the question about what happens after the circuit breaker, I think you're absolutely right. At the moment, it's like a spiral, isn't it? There's no light at the end of the tunnel. I think the challenges, and this is where I will be critical of the government, one of the things that's meant to help you to suppress it so you don't ever get into the issue of swamping the NHS is a strong contact tracing system. And the government has messed up on that. It's been pretty bad. And I think that's one of the challenges is for much of this, we're almost acting blind because we're not able to isolate enough people to take the pressure off this system, or at least especially in England. And I think that's one of the challenges. But in terms of what happens longer term, I've got question marks over that as well. It might be that one of the things the government needs to start thinking about, if the government's thinking strategically, is how it sort of completely transforms things like the school year to have regular half-term breaks, so you can build in the capacity for regular circuit breakers just to take the pressure off. I don't know. But the two things I'm thinking ATCM needs to be hard on is evidence base, so we know what measures actually work. And secondly is adequate business support. So if restrictions do need to come in, we can get those businesses through it. And I think for me at the moment, they're the two key things we need to be pushing on.
Okay, there's a comment in from Vaughan. I don't know whether you want to come on and speak, but it's just in terms of looking at the extension of bid terms and if there's some way that could be looked at. Vaughan, do you want to come in on that, or?
Yeah, just to add into what I was saying, it's really from what Michael was saying. We had a big city bids meeting this morning, so with about 20 of the city bids, and obviously a lot of these, and this was the major topic of conversation, but certainly what happens to bids who are going to ballot in the next year, the next 18 months, what's going to happen to them, but also those who are more struggling to bring in their levies at all, and how that's going to work. There was quite a push from some bids, which I think is probably even as they said it, they knew it was cuckoo land, but it would be a wish fulfillment, was to move to the American model where you're not reballoting. But as some people will be aware, before we went to the Brexit election in 2015, we did have legislation that was going to look at the particularly creation of property owner bids, but some other changes to the bid legislation, and that all dropped by the wayside. So it was a conversation this morning about whether we need ATCM, Bid Foundation, British Bids to really combine, to be looking in the short term again at another extension of the bid ballots, because there was an extension till next March, but obviously we weren't expecting to be continuing in this situation. So that's a pretty important thing. But then also to look at what flexibility there is of the bid structures, and how quickly we can look at the legislation, not in any way top of anybody's priorities at the moment, except for us as bids. But there are some, this has thrown up even more some of the frailties of the bid system, I think.
Okay, thanks, Vaughan. I see Sarah, Craig, you have your hand up, and then Kenny, do you want to speak again? Okay, Sarah first.
It was really just to go back to what Sally and OJ were talking about in terms of the circuit breaker. Obviously in Scotland we have had a mini type of circuit breaker in the central belt. That's due to end on the 26th of October. It'll be really interesting to see whether or not that has made any difference or impact on figures in Scotland. Judging by what I've seen in the news, I would suggest it probably hasn't. So again, it's back down to that sort of evidence base as to, you know, whether or not these short, sharp measures are actually making any difference to the figures. So it's just to say I'll be keeping a close eye on that, as I imagine you all will. But Nicola Sturgeon has said today that come the 26th of October, she's now looking at a tiered system similar to all of you. And there'll be no return to normal. So whether or not we go in a harder direction, or who knows, but that to me suggests that perhaps this short, sharp measure that she's put in already perhaps isn't working at all. So it does, you do question, well, what's the point then?
Yeah, and I do think, Sarah, that maybe Scotland will be the leader in this in terms of what evidence is coming out, because you'll be the first to come out of that sort of regime. So it'd be interesting to see that, and I think we do need to see the evidence. So I think you're getting here, OJ, it's evidence, and you know, the finances and the speed, and also looking at the bids. Kenny, very briefly, I know we're coming very close to the end of time.
Yeah, I'll be really quick. I just want to come back on a point that OJ raised before about local lockdowns. For this to work from central government, they need to involve the regions at a much earlier stage. You know, what we'd found up here, we were finding out more from the media than we were from governments as well. For instance, on Monday afternoon, before Boris Johnson made his address, Matt Hancock invited our local MPs to a meeting with 10 minutes notice. that's not good enough. You know, the regions know their areas better than anybody else, so they need to involve the leaders and the public health directors as well, you know, at a much quicker stage.
Thanks, Kenny. You're basically near enough bang on time. OJ, do you want to have a final word, and then we'll wrap up and maybe give a quick overview of what's happening next week?
Just to come back on some of those points, one thing I didn't say in relation to Sally's comments, I think she's absolutely right in terms of terms like lockdown and circuit breaker. They do, in a sense, become meaningless because they can be very different things in different areas. And so you always need to look at the specifics rather than just go by the term. Yeah, Vaughan, you're 100% right in terms of some of the things we need to be focusing on. Unfortunately, it is a priority for no one outside of our industry, but it is important for our industry, so we need to try and make it a priority. Now, fair play to Phil Prentice at Scotland's Towns Partnership. What he did a few months back, he's managed to convene a meeting of Scotland's Towns Partnership, ATCM, Bid Foundation, and some of the civil servants as well, top civil servants across the UK in economic development, to discuss bids legislation and what we can do to reform it and give bids some breathing space in terms of when they go to ballot. That is something I will catch up with him on. It is something we need to continue pushing. With regards to a move to property owner bids, I'm open for that discussion. One opportunity on the horizon is that the government is looking at reform of business rates, and one of the options on the table is a move to capital values tax. A move to capital values tax would effectively shift business rates to property owners, and that then gives you a system much closer to the American model, whereby you can identify property owners and you have the infrastructure there to actually levy property owners, where we don't at the moment, which is the whole problem. So that is something we'll be looking at actually tomorrow in our advisory council meeting. And I'm just trying to remember your comment was it on evidence as well?
Yeah, I think that's coming across strong, is that we need the evidence to actually back up the rationale in terms of all these restrictions coming in.
We need consultation as well, don't we? So I have been texting Jim McMahon MP. So for those of you that know him, he was up until recently the chair of the All-Party Parliamentary Group for Town Centres. He's now Shadow Minister for Transport. He's an MP for Oldham. He was one of the MPs that very recently got told with about 20 minutes notice he needed to be on a meeting with Matt Hancock and some of the top guys from across the Department for Health. And he wasn't happy. So that was on a Monday morning when he was on the train down to Westminster from Oldham. The consultation just isn't there. And that is also something that's got to change. So I absolutely agree with that as well.
Okay. Well, we've come into a lot of time. So thank you very much, everybody, for joining us. I hope you found it very useful. I certainly have. I think it's been a useful hour. Next week, we're still having another one. Nod for me, Karen, yeah. Again at 3:30. So I think these are very worthwhile for myself. So if you can encourage other ATCM members to join us, please do, because I think they're very beneficial. And thank you, OJ, for gathering all this together and hopefully taking it back to the APPG and getting our voice heard. So thank you all, everybody, and see you next week.
Thanks a lot, guys. Cheers.
Thank you.
Bye.
Bye.